Tonight, it looks into the state's COVID-19 dashboard and asks the question, is it current? Is it accurate? Is it transparent? State Auditor Rob Sand released that report for us today, and KWWO's Daniel Perot looked over the report for you tonight for this report.
State Auditor Sand says that the audit is one of several that's being done across the country looking at COVID-19 data. He says he and his team reviewed data from March 1st of 2020 through May 17th of last year, looking at Iowa code regulations and then also CARES Act reporting requirements.
This is a good news audit for the state of Iowa and for the Iowa Public Health Department.
State Auditor Rob Sand did not find any significant concerns related to the integrity of the COVID-19 data, but he says the data, which is collected by the Iowa Department of Public Health and displayed on the state's dashboard, can be more transparent.
We also found that the positivity rate calculations were accurate, although we would recommend that there be more transparency ahead of time on what sort of formula they're using to make those calculations.
The audit found the data on the dashboard matches the internal data on the state health department databases.
There were a lot of folks at the beginning of the pandemic kind of speculating about these late additions and wondering if this meant that there was something dirty going on. And we're here to tell you that we took a look at it and we didn't find anything like that.
But Sand says there are ways the state can improve the dashboard. He says the state should talk to schools, hospitals, and others about what types of COVID-19 data are most useful to them.
Make that data available for them where they can click on something else and then click on something else and really dig into what is the formula that you're using to calculate those positivity ratings, for example.
In a letter to Sand in response to that audit, IDPH Director Kelly Garcia said the data is collected by hand and then entered by humans. Garcia also said that the state health department's IT systems have been really taxed and had a hard time keeping up during the pandemic. She says they're currently looking at COVID-19 relief funds to replace their current internal system. Daniel Perot, News 7, KWWO.
Daniel, thanks for the update for us tonight. By the way, this new audit also suggesting that the state consider going back to updating that information on the dashboard every day. Remember what they're doing currently, different pieces of data updates come on Mondays, Wednesdays, and Friday, and this audit suggests they do it every day.